In a severe crash, occupants may be trapped by the interior of the vehicle. A steering column can pin a patient's legs, and the floor pedals can crush their feet, causing severe pain and make extrication difficult. It is important that you are aware of these rescue challenges and know how to approach and address them in a rescue situation. In this program, the training objectives are to demonstrate how to move or remove a steering column, to show how to move a dash, to show how to relocate or remove a pedal, and to demonstrate how to relocate or remove a seat. In severe front impact crashes, steering columns can bend down onto a patient's legs, causing significant injury, while preventing their removal from the vehicle. If this happens, you must know how to either relocate or remove the steering column to provide additional room for extrication so the patient can be freed. First, you must establish the severity of the entrapment. You may not be able to see what is trapping your patient, but you might be able to feel the contact points between the column and the patient's legs. Search for and operate the steering column tilt control lever. This slight movement may be just enough to free your patient and allow extrication from the vehicle. If this does not work, you may want to try to move the seat rearward. If none of these basic initial actions work, you will need to perform more advanced techniques to free your patient. Perform a full system shutdown so you can safely begin to cut and pry the vehicle. With shutdown complete, establish access to the patient compartment area. This may be as simple as working through an open window, but you'll more than likely have to remove one or more of the windows and doors. Once access is gained, you can cut and remove the spokes of the steering wheel, or the lower portion of the steering wheel column can be cut and removed to free the patient. To cut the wheel, rescuers can use tools such as a reciprocating saw, hacksaw, bolt cutters, or a power cutter. Avoid positioning the tool in front of or over the airbag deployment zone, or placing it into the patient care area. Make 2 cuts in the lower portion of the wheel and remove the section to provide more room. Alternately, you can make a single cut in the lower left section of the wheel and manually bend it up and away from the patient. Again, be aware of any airbag hazards before selecting this technique. If, after removing parts of the steering wheel, the patient is still trapped, you will need to move or remove the entire steering column. You can accomplish this task in a number of ways. One way to pull a steering column is often called lifting a length of chain. To perform this technique, place reinforcement cribbing on the hood near the firewall. Next, take a long length of chain or a strong strap and attach it securely at the front end of the vehicle. Then run the chain or strap across the hood and attach it directly to the steering column. You are now ready to lift the chain. Place the base of the lifting tool, such as a high lift jack, on the cribbing, with the lifting portion of the tool under the chain. Operate the tool to lift the chain or strap. As the chain or strap moves, it will pull the steering column up and away from the trapped patient. A second technique for pulling a steering column uses the intact windshield frame of the car as a base for pulling. Place a 4x4 or other strong beam across the windshield opening above the column. You may want to reinforce the top of the car where the 4x4 lays with additional cribbing or a pry bar. Then, take a long chain, droop it over the beam, and loop it down and around the steering column. Finally, hook the chain back onto itself, leaving a small amount of slack. To finish the pull, insert the tips of a lifting tool, such as a spreader, under the chain and on top of the beam. Then, operate the tool to pull the chain and the steering column up and away. If damage to the vehicle's frame or structure is so severe that pulling the column from the outside is not possible, you may have to push the column free of the patient from the inside of the vehicle. To do this, position the pushing tool, such as a ram or spreaders, on one side of the column inside the vehicle. Try to locate a sturdy base for the push, such as the rocker panel or hump near the floorboards. Open the tool so it makes contact low on the steering column, avoiding the tilt mechanism and knuckle joint. Next, operate the tool and begin to push the column free from the patient. You should watch carefully to make sure the tool does not slip off while lifting, causing the column to drop back onto the patient. An alternative to pulling the column is to cut it free from the vehicle. This technique is dangerous on any vehicle with airbags and should only be done when airbag deployment is not a risk. The most effective tool to use for this cut is the hydraulic cutters. Operate the cutters normally, cutting the column until it is severed or weakened enough to be moved away from the patient. A second responder should steadily pull the column up and away from the patient as the first responder is cutting. This will help the column to bend toward the windshield and release straight up when the cut is complete. If moving a steering column is not feasible or does not provide adequate space, you will need to move the entire dash of the vehicle to free your patient. If a patient's legs are trapped, a dash roll is a good way to free them. This procedure will move the entire dashboard, steering column, and firewall assemblies forward and away from your patient.
Wiggle your toes down there.
Perform this evolution with a pushing tool, such as a ram. First, make a 6 to 8 inch horizontal relief cut into the A-post near the bottom hinge. This will weaken the dash and allow the roll to proceed smoothly. Next, place the base plate of the ram at the base of the B-pillar to create a secure pushing point. If there is no B-pillar, support on the rocker channel can be clamped in place with a spreader. Then, extend the working end of the ram to the A-pillar, near the top of the front door hinge. Continue to extend the ram, pushing the A-post and dash diagonally up and away from the trapped patient. If you don't create enough space on the first push, you may need to reposition the ram and repeat the steps to free your patient. If the ram, after pushing the dash, blocks the extrication pathway, you may have to remove it. To prevent the dash from moving back onto the patient as you remove the ram, insert a wood wedge into the gap created in the A-pillar. Another dash movement technique is called jacking the dash. To do this, make 2 relief cuts in the A-pillar between the door hinges with a cutting tool. Then, use a power spreader to grip and bend the metal between the 2 cuts outward. Insert your spreading tool into the notch you just created. Begin operating the tool, spreading the structure of the A-pillar, dashboard, and firewall. As you continue to spread, the dash will lift up and away from the trapped occupant. Reposition the tool and continue spreading as necessary. In a crash, you will need to remove or move a vehicle's pedals if they are trapping a patient's feet. A hydraulic cutter or pedal cutter is the easiest tool to use to perform pedal removal. Insert the cutters into the footwell and cut the pedal shaft. If the crash damage is severe, accessing the footwell may be limited, preventing you from using power tools. Instead, you can use webbing or rope to move a pedal. Wrap the webbing or rope around the pedal shaft and footpad of the pedal. Then, begin to pull the pedal shaft to the side along its weakest axis. Continue to pull to the side until the pedal is no longer pinning the victim's feet in place. If relocating the dash is not sufficient, you may need to push, pull, or even remove a seat. Be very careful while performing this evolution in vehicles that have side impact airbags in the seat back. They can deploy or redeploy if accidentally triggered. First, try and move the seat manually. If it is stuck, you will have to use power tools, such as a ram or spreaders, to assist you. Place the tool just above the base of the seat, where it makes contact with the seat tracks. Then, have a second rescuer hold the seat release adjustment mechanism in the neutral position. Next, operate the tool, slowly pushing it back on its tracks. Stop before the seat is pushed off the end of the seat tracks. If total seat removal is necessary, you can cut or chisel through the seat bolts or the seat tracks. To do this, use an air chisel, a power cutter, electric reciprocating saw, even a hammer and cold chisel. You can also use a spreader to remove a seat that is blocking the extrication pathway. Place the spreader between the base of the seat and the seat tracks. Operate the spreader to force the seat up and away until it breaks free from the floor. As a rescue worker, you will respond to accidents where the patient is pinned by the steering, dash, or pedals and needs to be freed. You may also have to move or remove a seat to create adequate space for a successful extrication. Knowledge and understanding of the techniques presented in this program will help to ensure your success. In this program, we have shown how to relocate or remove a steering column, how to perform dash movement techniques, how to relocate or remove a pedal, and how to relocate or remove a seat. When a violent crash occurs and patients' bodies are trapped by the insides of a vehicle, they need immediate medical attention. Understanding the techniques and skills outlined in this program will enable you as a firefighter to free them quickly and deliver them to waiting medical personnel.